So, hello viewers, welcome to another vlog. And today in this vlog, I'll be talking about one virus that is gaining attention of the international media right now. You have heard about the news that there is a new outbreak that is going on in China with a new virus, and it was identified that this virus is human metapneumovirus or hMPV. So, today in this video, I'll be talking about this virus. So, what is a human metapneumovirus? Now, this is one respiratory virus. That means it has an affection for the respiratory system. It affects the lung and the upper airway of our body commonly. So, it is first of all, it is a respiratory virus, and it is it was first identified in 2001, and it was identified that it is a member of the Paramyxoviridae family of virus. So, this is the Paramyxoviridae family of virus. This is the basic structure of this family of virus, and this new virus, it belongs to this family of Paramyxoviridae. And this hMPV virus, this virus can produce respiratory illness, and the symptoms can vary from mild uh, cough and cold to severe lower respiratory tract infection. So there is a quite variation in the symptoms of this disease. Now let's coming to the epidemiology of this disease. So this virus, it uh, it has uh, special affection for the younger and the old patients, and also it it commonly affects the immunocompromised persons. That means who has a weak immune system, probably due to some inherent conditions like diabetes, or if they are taking steroid-like medications for longer duration, or if they are HIV infected, or they are receiving any kind of chemotherapy for any cancer, they are also prone to this infection, as well as young children and older adults. As we know that older peoples, they are relatively immunodeficient. So children, older people, and those who are immunocompromised, they are more likely to get this infection, but it is not a rule. Any person can be infected with this virus. Also, those people who has some kind of a chronic lung or heart disease, so they are also prone to this infection. So, children, older adults, and any person with a lung or cardiac disease, or someone who is immunocompromised, they all can get infected quite easily. Now, is there any seasonal variation for this infection? It was observed that in the late winter and early spring, this virus has shown some of the chances of turning into a epidemic, or rather, you can say in a pandemic state. So the late winter and early spring, this is the time when there is more chance of getting infected by this virus. Now, what is the mode of transmission of this virus? This virus can easily be transmitted through respiratory droplets. That means when someone coughs, there is he basically spread small, very tiny droplets of oral and nasal secretions, and these tiny droplets they can carry this virus, and this virus, and with the help of these droplets this virus can infect any person. So it can be transmitted by respiratory droplets, or with close contact, or some contaminated surface, like any surface, or any doorknob, or those substances which are commonly shared by a lot of people. So that can be a source of infection. Now let's talk about the symptoms of the disease. The symptom of this condition can vary in severity, and also uh, it has variability in manifestation also. It can present as a mild illness like running nose, cough, nasal congestion, sore throat, fever, or it can present with a severe illness like wheezing, difficulty in breathing, or bronchiolitis. Now, what is bronchiolitis? Now, bronchiolitis is a condition when there is necrosis of the epithelium of the airway, and there is a lot of inflammation, there is uh, development of mucus plugs, and all this leads to various respiratory symptoms. Also, in severe cases, it can present as pneumonia, or it can present as acute exacerbation of asthma or COPD. But it is seen that the severe disease that is commonly seen in infants and young children, or elderly individuals, or individuals with immunocompromised status, the severe form commonly is seen in this group of patients. Now, coming to the diagnosis, the most important method to diagnose this condition, that is reverse transcriptase PCR or polymerase chain reaction. With the help of this investigation, we can detect the specific nucleic acid sequence of this virus, and this is a gold standard method for diagnosis of this condition. Also, we can detect with the help of antigen detection tests or serology. They can also detect this condition. Now, regarding um, treatment, there is no specific antiviral treatment for this condition. The management is principally supportive. So, in mild cases, we have to maintain hydration, we have to give paracetamol to control fever, adequate rest has to be taken. In severe cases, we uh, might need to give insulin, in give oxygen. Also, in severe cases, we may have to give mechanical ventilation. And along with this, we can also give bronchodilators or corticosteroids if there is asthma-like features of or if there is exacerbation of the COPD. Now, the most important thing, that is what are the preventive measures? How we can prevent this condition? So we have to take certain hygiene measures like frequent hand washing. As you can see that we have to wash our hand properly. That can prevent transmission of this disease. So we have to use masks. Uh, we have to avoid touching face, covering coughs or sneezing. We have to cover our mouth whenever we cough or sneeze in a public place. Also, we have to clean the we have to clean the environment, the commonly shared objects within the house. And if someone is infected, we have to isolate that person until recovery. Regarding vaccines, currently there are no licensed vaccine available right now. There are some trials which are undergoing. Probably in near future there will be some vaccines to prevent this condition. Uh, so that's it for now. If you like this video, then don't forget to press the like button. And if you are new to this channel, then don't forget to subscribe to my channel. And if you have any query regarding this topic, you can directly comment in the comment section below. I will definitely answer to your query. Thanks for watching.